everyone, this presentation covers section 6.9 on the COVID-19 pandemic changes to the National Health Interview Survey. This is the second presentation on Chapter 6 in the textbook Big Data for Epidemiology, Applied Data Analysis Using National Health Surveys. Here is an outline of the presentation. Sections 6.1 to 6.8 were reviewed in the previous presentation. Section 6.9 will cover the COVID-19 pandemic changes, including data collection changes in Section 6.9.1, survey content changes in Section 6.9.2, and the complex sample analytic changes in Section 6.9.3. Section 6.9, COVID-19 changes. The initial chapters in this textbook were written from June to December 2020. During the initial waves of the COVID-19 pandemic. So pre-pandemic survey methods have been described. However, many surveillance systems and surveys had to be changed due to safety concerns, stay-at-home orders, and data collection needs. There was a need for data to be collected more efficiently and more content to be collected for evidence-based public health and policy decision-making. So this section provides an overview of the data collection changes, the survey content, and the complex sample analytic procedures that were changed by the NHIS during that time. Section 6.9.1, Data Collection Changes. On March 19, 2020, data collection methods were temporarily switched to telephone only. Online methods were not used for the NHIS, which may be a surprise to some data users. However, the National Center for Health Statistics already had online systems set up for COVID-19 timely data collection. So data was able to be collected online regarding COVID-19 using the Household Pulse Survey by the U.S. Census and the Research and Development, or RANDS, survey by the National Center for Health Statistics. Here is figure 6.1, NHIS data collection changes. In this figure, it outlines the different changes across the year in 2020 going into 2021 data collection. So from January to March 2020, in quarter one, data was collected as previously in individuals' households. Then on March 19th, data was temporarily switched to telephone in quarter two. And this procedure was done only between March and June. From July to December, data collection was done by phone if participants were available. However, if participants were not available, then they were able to be, data were able to be collected from them in person from their households. Then from August to December in 2020, an additional data collection procedure was implemented by the NHIS. They implemented what was called the 2019 Follow Back Survey. This allowed them to go back into their records to find the telephone information of previous participants, and then they surveyed them again. So this is the first time that the NHIS has collected data to allow for longitudinal responses. Then in 2021, in-person data collection procedures were resumed. However, a priority was given to telephone procedures. So if individuals were not available by telephone, then they were able to be, data was able to be collected by in person. Section 6.9.1, data collection changes. So as I mentioned in the previous slide, the telephone method was used first. Individuals were contacted by telephone before any in-person methods were used, and they only used those if they needed to drop off some sort of recruitment or survey materials, or they just did not have a telephone number for individuals in that sampling design. Safety precautions were used by the data collectors if they needed to be done in person. So they used masking, social distancing, and collected data outside as needed. Section 6.9.2, survey content changes. So the NHIS also made several changes to the content that the data were collected In 2020, in quarter 3 in July, they added several questions for adults and some questions for children as well. Questions for adults included whether or not individuals had either been diagnosed, been tested, or tested positive for COVID-19, and whether or not their access to care for other health reasons was impacted. So whether or not they delayed medical care, whether they just decided not to receive medical care, and whether or not they used telemedicine instead of in-person visits. For individuals with cancer, there were questions on whether or not treatment was received, changed, or delayed, and caregiving, whether or not individuals received care by a nurse or other health professional, friend, or family member. They also had questions on the social and emotional support changes in the last 12 months and social distancing measures at work. Among children, questions included whether or not they were ever diagnosed, whether they had been tested or test positive, and the access to care questions were also collected from children. In 2020, questions were asked on COVID-19 vaccines. So individuals were asked whether or not they had had a COVID-19, how many COVID-19 vaccines they had, the month and year of the COVID-19 vaccine, and they were advised, or they answered questions on whether or not they were advised that they needed an additional COVID-19 vaccine. So for example, if they needed the additional vaccine due to health reasons before a booster was recommended. Those were added in quarter 2 and only added among adults. Section 6.9.3, Complex Sample Analytic Changes. So the changes in the data collection procedures led to many new potential biases that need to be accounted for when analyzing the data. From April to June 2020, it was noted that there were higher subgroup responses from different groups than there were prior to that change. So there were higher response rates in that period compared to the previous first quarter. These higher responses were from adults ages 65 and older, individuals with 4-year college education or higher, individuals with family income greater than 75,000, individuals who owned their home, and whether or not they lived in that current residence for 11 years or longer. So previously, the NHIS has always calibrated their weights to match the US Census population estimates. So prior to 2018, they adjusted for age, sex, race, and ethnicity. Then in 2019, they added education, census division, and metro areas. And then in 2020, they needed to adjust for housing tenure. And so with these changes, they created 4 separate analytic files: the sample adult interview file, which includes all adults, the sample adult longitudinal file, which includes the 2019 follow back adults only survey, and then the sample adult partial section that does not include the 2019 follow back adults, and the sample child interview. So if individuals are only wanting to look at specific information about people in 2020, then they would want to use that sample adult interview file. If they wanted to look at comparisons between those who completed the survey in 2019 and 2020, they would use the sample adult longitudinal file. If you wanted to compare years across multiple years, which I have done in my research in the past, you would want to use the sample adult partial file, because if you use the sample adult interview file, you're going to be double counting individuals from 2019 and 2020 that were part of that follow back design. They also had one file for the sample child interview. So table 6.5 provides an overview of the 2020 NHIS final weight variables for each file type. Here we have the sample adult file at WTFA_A, the sample adult longitudinal file at WTFA_L, the sample adult partial file at WTFA_P, and then the sample child interview file, WTFA_SA. Those are the specific weighting variables for each of those files. And so here are some links for more information. The top link has a PDF that has the weighting and analysis reference table that's available with specific examples of how you want to weight it on their website, and more details on the data collection, weighting procedures, and bias assessment for the 2020 NHIS is available at that link provided there. The details of the 2021 NHIS weighting are not available as of this writing. So here are some references that have been added to Chapter 6 due to the addition of this section. And that concludes my presentation on Section 6.9, COVID-19 Pandemic Changes to the National Health Interview Survey. Thank you so much for listening.